Hello guys, welcome back to Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. Today we're going to be discussing about breast implant illness. This is a very hot topic and there's a lot of information and misinformation out there. So I wanted to take the time to explain it all by itself and not combine it with other topics so I can answer your questions and make sure everybody understands this, okay? So we'll start by discussing a little bit about what it is, what it entails, and then we'll jump into some questions. So breast implant illness, it's not actually a diagnosis because it's not a medical entity, okay? Breast implant illness is just that there are a lot of different symptoms that patients have been describing, and we're putting in this basket called breast implant illness. Why it's not a diagnosis? It's because unfortunately we haven't found what is it, and if it's really the implant that's causing it or who is going to develop it. It's a topic that it's very poorly understood, and that is why we can't really label it as a diagnosis just yet. It is something that has been popularized in the last couple of years, since 2017, 2018, because there were a movement of groups in social media talking about this. And I think it's important to talk about it and to understand that it is an entity, and there are patients that has suffered and there are patients that improve after the implants have been removed. But we have to take things into perspective. It's not that everybody's gonna get it. And we haven't found that the silicone in it is causing it. So those two things are very important, and very important for patients that are thinking about getting implants and are scared about breast implant illness to understand. All the studies that have been done, we haven't found a direct correlation. And that is the reason why the implants are still in the market, because if it was a direct correlation that you put the implants and you're going to develop breast implant illness, then we would have seen a lot more cases of this and we would have changed the implants, right? So that is not the case. And why is it so hard? One, because there is a lack of a database that accumulates worldwide since the 60s and 70s, and when the implants, we started to put implants in, to see all of those patients that had implants placed, how many developed breast implant illness, how many developed these symptoms, did they require, was it rupture, was it not rupture, the implant when they developed the symptoms, was it right away, was it after? So there's not really a database. There's a database that the FDA has, and the study that we rely mostly on, it's associated with this database. The problem with that database is that is patient and doctor, they put the information in if they want to. So most of the time you put the information in because there's a problem, not because everything is okay. So the majority of patients don't put the information in on the FDA website because the implants are good, they don't have any problems. So it's very hard to do a statistic with that information when we're lacking a lot of numbers, okay? So basically, a basket, right? Breast implant illness is a basket that accumulates all this diagnosis, all these symptoms really. What are the symptoms? So that's the other problem. It's very wide. It's very different from person to person. And every patient that is describing breast implant illness describes this differently. So it's very hard to say, yes, this is it. Okay, the most common reason or the most common symptom for patients to seek help is fatigue, which is a very broad symptom that can be caused by many things. The second most common is joint pain, and the others that are common is brain fog, memory loss, weight loss, weight changes, weight gain, hair loss. So you can see it's muscle aches, muscle pain is another one that it's pretty common. So you see that the symptoms are very broad as well. It can be caused, usually it's by thyroid disease, by autoimmune conditions, by depression, anxiety, fibromyalgia. So there are a lot of conditions that can be causing these symptoms. The other thing that it's hard is that breast implant illness patients describe the onset of symptoms from right away to years later. So it's hard to put a correlation between the implant and the symptoms, because a lot of patients, the symptoms didn't start right away. They started even years after the implant was placed. So what are the things that we are thinking that may be contributing to this? The silicone in the outer layer of the implant may be causing an inflammation in the body. That's the theory, but no one has been able to identify it when they check the capsules of these patients and they study it, okay? The other thing is that they think they can hypothesize that patients that have autoimmune conditions, allergies, or are prone to allergies may be at more risk of developing breast implant illness. Why? Because their bodies are kind of more reactive to the environment, autoimmune, creating inflammation. But not all the patients that have been treated for breast implant illness symptoms have had that history. And the other thing is that not all the patients that describe the symptoms and go to get the implants removed improve. So there are approximately 20 to 30% of patients that have had the implants removed and the capsule removed for breast implant illness symptoms don't actually improve. So what's the course of action? What to do? If you're thinking about getting an implant, read about it. Get into studying what it is. Know the numbers, which are very low percentage of patients describe these symptoms, and put it in a balance, right? Put it in comparison to how much do you want to improve the shape of your breast, improve the volume, and how much this bothers you. If you are going to be too stressed about this, and this is going to affect the happiness of the surgery result, then don't do it, right? Check other procedures of the breast, like a breast lift, and understand that volume-wise, you're not gonna have a big change, but it's putting it into perspective and putting it in how important this is to you. But understand that breast implants are very, very safe, and it's very rare, very small percentage of patients actually develop these symptoms. And a lot of the patients that develop these symptoms actually get diagnosed with other conditions, autoimmune conditions, thyroid disease, fibromyalgia, depression, that explain the symptoms, okay? So, and if you had implants, it's like, I had implants placed 10 years ago and now I'm worried that I'm gonna develop this. Just know that these are the symptoms that are described. If you are feeling any of this, what's the next step? Get a consultation with your plastic surgeon to talk about your symptoms, the onset of them, to check what type of implant you have and the correlation to breast implant illness with your implant specifically, and go to your primary care to get a full workup. What is a full workup? Checking your thyroid, checking for autoimmune conditions, CBC, your hemoglobin, checking for diabetes, all of these things that may be contributing to your symptoms, and it's actually not the implant. What happens if you rule out everything, right? You went to your PCP, you checked everything, all the blood work is fine, there is nothing wrong, and this symptom started once the implant was placed? Well, it could be. That's the unfortunate part, is we can't really say yes, this is breast implant illness. We don't have a blood work, a lab, a test we can do. It's just a rule out. So we ruled out everything else and you still having the symptoms correlates with when you had your implants placed. So what do? So the options are remove the implant. Remove the implant with the capsule. The capsule is the tissue that it's around it. So that you've probably heard about what's called en bloc capsulectomy. There are a lot of surgeons that are marketing, I'm an en bloc capsulectomy surgeon. I remove implants to cure everyone. Be careful with those type of advertisements because sometimes people take advantage of situations. And I'm not saying that if a surgeon specializes in en bloc capsulectomy is taking advantage. I'm not saying that. I'm just saying be careful because there might be situations where people market things a certain way to profit from those surgeries. My advice is go to your surgeon, go to your plastic surgeon. You had a relationship with that surgeon and you chose that surgeon for a reason. So go to that person. He knows or she knows what implants you have on and can tell you about the options, okay? So the options surgically is en bloc, which is basically removing everything together. So here's a picture. This picture is from the internet. This picture is from one of my patients. But basically, this picture shows what an en bloc capsulectomy is. Basically, you see that tissue that is a little bit raw, yellow, pinkish. That's the capsule. And the implant is actually on the inside. So you remove it like completely. Some people argue that because you're removing it this way, the silicone is not touching the outside, so you're removing it completely and out of the body. But again, there hasn't been a study that has shown that this is the way of doing it. It's just approaches that some surgeons take. I try to do it en bloc if I'm gonna do it, but the thing is that the capsule, especially if your implant was placed under the muscle, can get very attached to your chest wall. So sometimes removing the capsule from the chest wall can be more dangerous. So I try to do an en bloc resection if possible, but I am not going to risk injuring your ribs, injuring your lungs to try to get the implant and the capsule out, right? I'm going to take the implant out. I'm going to take as much as the capsule out as I can, making it safe and avoiding any injuries to the intrathoracic or the ribs and the muscles of the chest wall, okay? So if possible, yes, en bloc. If not, then you can do a capsulectomy, which is removing the implant and also removing the capsule, but not together. So a total capsulectomy is, this is a capsule and this is a capsule. This is an implant that is ruptured. That's why the color is different. And this is an intact implant. You see that it's similar to this. So she had this, the right side was ruptured, and you see that the capsule is actually like it looks smaller. It's not smaller, it's just that it's thicker and it contracts like a little ball. So it seems that it's smaller because I removed the implant from the inside. But basically, I removed everything, the capsules and the implants. There is some inherent changes of your breast that are gonna happen, right? When you put an implant in, there is some stretching of your breast tissue and skin. So, and it may be some atrophy of your breast. So people or patients that get implants removed may then see that when the implants are removed, they say, I used to have even more breast tissue before, and now I feel that I lost some volume. And it's due to the implant stretching the breast tissue and also aging. You probably had that implant placed 10 years ago. Younger breast tissue is thicker and denser than older breast tissue. So when you get it removed, yeah, you may notice a deflated look. So what are the options for that? There's some people that argue to place another implant. I'm more in the school of thought that if you had problems with an implant, then you shouldn't put another implant in. We don't really know a lot about this condition to know if you're going to develop it again. So why go through that? So, and the aesthetics are going to be different. You have to be okay with having smaller breasts. We can lift them so the shape is better and the position of the areola is okay, but you are going to have less volume. There's the option of breast fat grafting to the breast that I don't do it. There's an option to that, but as I've mentioned before, I don't like to do it because you don't really see a change in the volume of the breast, just very minimal, and it increases the risk of having calcifications and areas shown on mammogram that may need to be biopsy because we don't know if they're cysts or they're new lumps that need to be ruled out as cancer. So I don't think that's a good option. I think that the best option, unfortunately, is just to remove the implants, reshape the breast with a lift, and just avoid putting another implant. But I'm gonna discuss it with the patient. Probably the implant that I'm removing, it's not a 5th generation silicone implant like we have now, right? So there is some argument in the community that the implants nowadays, the capsule is different. There is not much leakage of silicone like the prior generations of silicone. Now the capsule is stronger and there's no leakage of silicone like before. So the new implants shouldn't be causing this inflammation like the prior. But again, this is all speculation and what we think it's gonna happen, but there's no one that really knows because we don't have a direct correlation from what it is to what's causing it to how to avoid it, okay? So my recommendation, rule out everything with your primary care. If you ruled out any other condition and you still have all these symptoms and it correlates directly from when you had the implant done, then sit down with your plastic surgeon and discuss your options, which are to remove the implant, which does not guarantee that the symptoms are going to go away. Like I mentioned, in surgeons that have done multiple, there are a series of 100, 200 cases of patients that have gone en bloc capsulectomy implant removal, and 20 to 30%, so 2 to 3 out of every 10 of those patients continue with the symptoms. So that lets you know that it might not be the implant, okay? The other 7 and 8 patients did improve. So are you gonna be the one in the 80% or the one in the 20%? Unfortunately, we don't know. But my recommendation would be, if you ruled everything else, do an en bloc capsulectomy if possible and if safe, and just do a lift to reshape the breast and don't put another implant in, okay? Once we have more information, then we can address if you're going to be a candidate for another implant, if that's a possibility, which I think with the newer generation of implants, I think it's going to be different, but that's just my opinion and not based on anything on the literature, okay? So that basically describes what breast implant illness is. I know there's a lot of fear and a lot of discussion in social media, specifically in the groups that discuss this, but try to read about it, get the information, and make an informed decision. Okay, I'll take some questions.
Yes. So, do the doctors inform the patients on any recalls on their implants, of any?
Yes, definitely. If there is a recall of the implants, the surgeons are obligated to notify you. One, the FDA is going to so this happened with textured implants recently with the advent of the breast implant associated ALCL, which is a lymphoma, anaplastic large cell lymphoma. It's a very rare form of cancer that has been associated with textured silicone implants. So those implants were recalled here in the US. So if you had one done, the FDA, it was all over the news, it was all over social media, but again, your surgeon also needed to send you a letter. You had that placed, just make an appointment with us to discuss options, right? And yes, the companies that of the implants were giving some economical incentive and help for coverage of the new implants and the surgery of the removal. In my case, my patients, that was not the case, because all the implants that I put are smooth. So basically what the difference is the coverage, right? So this, you see that's very glossy, it's a smooth capsule. The texture capsule, it has like little lumps in it, okay? I have never put a textured implant since I was at the University of Miami, like before here, not here, because the smooth implants were associated with a better outcome. So I've always put this, but usually patients that had implants placed years ago, and if you have implants placed outside of the US, you may have had placed a textured implant, and those were recalled.
Okay. This is not a question, it's a compliment. Maria Victoria says, wow, it's awesome you're talking about breast implant illness.
That's great. I know it's a topic that not a lot of surgeons want to talk about. And I understand, because there's not much literature, right? Us surgeons and us doctors, we always want to talk with numbers. This is the percentage, this is the risk, and unfortunately, that doesn't exist for breast implant illness. But it's good to talk about it. It's not, we don't have to hide it. We don't have to pretend it doesn't exist. I think it does exist. I think it's very rare, but I think it does exist. And there is evidence that patients have improved after the implants have been removed. So, I mean, there is an illness that we need to find out what it is more. And it's important to talk about and discuss it.
Okay, how soon after my first round can I book my round tour with you? I guess it's a BBL, right?
Yeah, I think I was getting the same thing. So with a BBL, you should wait 9 months to 1 year after the first round to get the second round, mainly because of the liposuction. So liposuction creates a lot of scar tissue on the inside, and we need to get that scar to heal and kind of get softer, so I can do another round of liposuction. Liposuction patients, they know, like if you've had liposuction, you know what I'm talking about, that at first everything feels hard, everything feels swollen, and it's not until like 9 months to a year after that your skin and everything starts to loosen up.
The breast cancer illness is related with breast cancer?
No, so breast implant illness, that's a very good question, and it's not been associated with any type of malignancy. It's just these symptoms that people describe that are more autoimmune, fatigue, weight loss, joint pain, muscle pain, depression, anxiety. So are symptoms that are very broad, and not related to like one organ or one area, but it has not been associated with a malignancy. There are 2 malignancies that have been associated with breast implants. They are very, very rare. One is the lymphoma that I mentioned earlier. It's called breast implant associated anaplastic large cell lymphoma. Very long name, BIALCL. So that lymphoma is extremely rare. It has only been associated with textured implants, so those are out of the market here in the US. And the other one that it's very new, that they just sent a letter this past month or 2 months ago, it's a squamous cell carcinoma, very rare, also found in the capsule of very old implants. We're still trying to find more about it, and everyone that has patients with this, it's encouraged to send information to the FDA, because it's only a few cases, extremely rare, but I'm reading about it and keeping informed, so I'll let you guys know when we have more information about that.
Can you do a tummy tuck, a scalp, and breast augmentation at the same time?
Tummy tuck, which one? What was the second one?
A scalp, I guess.
Scalp. Okay, so I mean, I do some liposuction with the tummy tuck. And yes, combining the breast and the tummy tuck, we can. That's what we call the mommy makeover. That we combine a breast procedure, usually a breast lift with implants, but it can be any type of breast procedure, breast reduction, breast augmentation. Combine it with a tummy tuck. And yes, I do liposuction to the flanks, which is the waist area to accentuate the waist with the tummy tuck. But I don't do a 360 or a more extensive liposuction with a tummy tuck or a BBL because there's a limit here in the state of Florida. I operate in an office-based facility, so the Department of Health has a limit because of safety reasons, because I'm not in a hospital, that when I'm combining procedures with liposuction, I can only remove 1 liter of fat. So that is not going to be enough for a 360 or a BBL. When I'm doing liposuction procedures alone, I can then remove 4 liters, and that's plenty to sculpt and transfer if we need to. So 1 liter is more than enough for the flanks, and it really accentuates the waist and gives a nice shape.
Another comment. Doctora Vidal se ve súper linda, new mommy body. Para nada, se ve bella.
Gracias.
Okay, and the last question is about saline implants. Saline implants are safer about implant illness?
So that's a very good question. Most of the things associated with the inflammation are related to silicone. So you might think, then I put saline implants and I avoid that. Unfortunately, the saline implant, the cover, so this part is also silicone. So you need something to hold the water, right? So the capsule of the implant is still silicone. So the risk is the same. It's been associated with both saline and silicone implants. Yes. So thank you guys for all the questions. I hope this helped a lot to answer a lot of the questions that we have about breast implant illness. And yes, it's an ongoing topic, ongoing research and ongoing information. So this is going to change. Probably in 5 years, I'll be talking about breast implant illness, and it's going to be different. But that's medicine. That's what it is. So I'll keep you guys informed whenever I receive more information. And I'll see you guys next week on Tuesday Tips, next Tuesday. Bye bye.